Hello, today I want to talk to you about proper care of the intact penis. Many people have forgotten this information with the prevalence of circumcision over the past 100 years in the United States. So first, a little bit about me. I am almost finished with my master's degree in health science, and I've done most of my research on this topic, the harm that circumcision does and the benefits of the foreskin. Also, on top of that, I myself am intact, so I have the personal experience. But enough about me. Let's get started on talking about the proper methods of care. First of all, it is very simple. Many myths are out there that make it sound very complicated and very difficult, but it's not. For an infant and a young child, you wash it from base to tip, on the outside like a finger. That's it. There is no retraction that should ever be done. As the child grows older, eventually he will begin to retract. Once he has retracted on his own, that is, only he himself should ever be the one to retract it, then he can rinse it under with plain water only, never soap. If he does not do it, that's fine too. There is no reason to retract and rinse until at least after puberty. Even after puberty, as long as the boy is retractable, then he should retract and rinse underneath with water only. Again, never soap. Once again, this is up to him. He should not be nagged by parents or physicians or anybody else. The reason being that when a boy is newly retractable, it may be very sensitive under there. So a boy may not be retractable until 15. And it may be until 16 before he feels comfortable enough to retract it under the water and to rinse it. So no one should pester him about this. Boys are not stupid. They will take care of it just fine. And as long as you have told him at some point you will become retractable, and when that happens, once it feels comfortable, rinse it with water only and do not use soap. This is all that needs to be said. There is no need to keep checking to see if he's retractable, to see if he's washing or reminding him. Tell him once or twice and then let him handle it. It's his penis and he'll do just fine taking care of it. Remember, the foreskin is supposed to be there. It's not prone to disease. Many people have forgotten this because of the prevalence of circumcision. The foreskin protects it in childhood, protects it basically all of our lives. So there is no need to have it covered, to have it retracted or removed or anything like that. Soap actually causes some of the problems that people blame on the foreskin. It's not the foreskin, it's the soap and the excessive washing that they use. Soap changes the pH of the skin underneath there, and this actually makes it more prone to yeast and other problems. So the very thing that people think they're doing to make it cleaner is actually encouraging disease. So please, only wash the outside, never use soap, and leave it up to your boy when he is comfortable retracting. And then one more thing is, many people say, oh, my son is retractable and he's 5, let's say. Should I have him rinse it? No, there is no need. Even if he's retractable on the early side, which 5 is on the early side, there is no need to retract and rinse until at least puberty. And once again, even then, once he is comfortable doing so. Remember, the age of retraction, average age, is 10 and a half, 11. Some do it earlier, some do it much later. It's not bad or a problem for a boy to be unretractable at 15, 16, 17, even 18. This sometimes happens, and that's okay. Have a nice day, and I hope this information will make this clear, lessen the mystery, and encourage you to take proper care of your son's penis. And for those who are intact themselves, to know how to do it properly and not to worry about it. Thank you.